Hi, I'm Dr. Ben with Performance Therapy Group. I'd like to show you the hip hinge. It's a critical piece of low back stability. In fact, I think it's the most important thing in terms of low back stability. The whole point for the hip hinge is to get the last segment, L5, S1, or L4, L5, to get in proper spinal alignment. And so what you want to do is find neutral pelvis and then get into a little bit of extension, which I'll show you that in a second. But to find neutral pelvis, you tuck your pelvis, you do a posterior pelvic tilt and then an anterior pelvic tilt, and you can see how my hips are rocking back and forth. What you want to do is rock them forward as far as you can to the point where the joints in back actually approximate. They'll kind of pinch together. The muscles will feel tight in your back there. And so from that position, you want to lock in your pelvis in that position and not move from that. So once you've found neutral pelvis, what you want to do is lock in that position so that the spine doesn't move at all. And what we're going to do is, they call it the hip hinge because you hinge only at the hips. Every other joint is locked out and stiff, which means stable. So to start this, you put a slight bend in the knee, which will put a little bit of dorsiflexion at the ankle and will get you to where you're not relying so much on your hamstrings. You'll use the glutes a little bit more also. So neutral pelvis, locked in, actually a little bit of anterior pelvic tilt. So neutral would be straight up and down. I like to put a little anterior pelvic tilt, which contracts the muscles of the low back a little bit and provides a little bit more stability. So from this position, what we're going to do is have them bend forward. See, there's no movement at the knee and no movement at the ankle. It may move front to back a little bit, but the joint angle is not increasing or decreasing like this. So versus a deadlift where you bend both, this is different because all we are doing is teaching them how to lock in the spine so that it doesn't move and only hinge at the hip. That's why we call it a hip hinge. So from this position, you lock in and you have them typically drag their hands down their legs like this. Now, if they can pick that up right away, perfect. The easiest way to teach this is to put a pole on their back just like this. Have them put one fist right on their sacrum and one right on C6. So you hold it just like that, which puts them in pretty good position. You can see if their neck is able to hit that position. I have to arch my back and get in good position just to hold that. People with excessive kyphosis are going to have a heck of a time doing this, so they'll realize how much kyphosis they have because they have to get into a whole bunch of spinal extension just to get into this position. Well, good, because they need that. So holding this where my thumb is against my C6, my hand is there, I retract, I'll switch hands. I'll retract my neck so that it touches there, and then this is on my sacrum right there. So I don't have any spinal flexion. My spine should not leave my hands when I do this. So from this position, now I'm locked in. Now I bend, again, only at the hip, and I flex forward and come back. So if you see any movement, any of this, then you can see that they're moving at the knees. You want to correct them and have them just move at the hip, just like that. And I would have them do a set of 10, 5 to 10, and make sure they've nailed that. This is the most basic and fundamental movement to stabilize the spine and make it so that people aren't damaging their spine when they're getting up from a seated position, lifting things, all sorts of things.